All right, everybody, welcome in. Today, the topic we're going to discuss today is building personalized physical exam or review system templates, or just maybe we'll do some basic template building in general, but mostly wanted to show folks how to do some basic physical exam templates to start. So when you're in physical exam, um, you have these categories obviously that you've seen. Now, the reason we've recommended that you use physical exam is because that is the that works for the E&M coder, and so if you examine each one of these systems, it actually counts how many systems you examine. And when you use the on the billing screen, if you can see this, when you click on the E&M coder, it's what builds this automatically for you and suggests the code for you. Now, we do have a lot of templates now that use physical exam for the reason we wanted to continue to encourage everybody to use physical exam. If you've built stuff into examination, that's likely fine. Just know that you won't have the help of the E&M coder. It doesn't count these categories. So within physical exam here, you have exams by system. Briefly wanted to show so I'm just going to hit clear all, and that'll clear my whole physical exam. Turn my dragon off there. So now you'll notice when I hit clear all, now I have no physical exam. So that's a fast way to get rid of a physical exam. And then within each category, you do have the option of clicking default per category and kind of going down this way. And this will take you system by system and put in a generalized exam per category. Now, as we discovered yesterday, Ben, somebody's made the default to include a C-section wound exam here, and I gotta fix that. So I'm taking that off right now, and I spent a few minutes the other day trying to take the default off, and I couldn't figure out how to do it, so I need to spend a little more time on it. But yeah, what was that?
I noticed that in the HENT exam, sometimes fontanelles are defaulted on too.
Yeah, you're right. They sure are. Yeah, I gotta change those. That's really good. So I think some folks have been playing around with the defaults, and we got to get that more generalized. So that is one option. That is one way of doing it, clicking default per category. Now you can see what some people want on their defaults. Maybe pediatricians only want fontanelles on every exam, so that's got added by one of them potentially. Not sure where that got added, but then I'm not sure how C-section got added into default as well. So we'll have to get those settings filled up, but we can. That is one way to do it. And the fact that those things happen is maybe more reason to build your own personal ones, which I'm going to show you. Which I'm going to show you how to do. So you have those by systems. That is a fast way to do a default per category. Now you can create your own defaults per category a couple different ways. So for general, once you put in what you like on your default per category, let's say you like to comment on their ill appearance, none, and you also like to comment on appears their stated age, yes. Whatever it is, however you like to modify it from here, then you can click default per category. If you click this arrow right here, you can do save as. And now you can save this as however you want to title it. Whatever you want to title it, normal, extended, general. So now, when I come in, so I'm going to go ahead and clear my exam. I'll show you. The one thing that is a little rough about this method is it is a little clicky, but now you can see I now have it defaulted per general. That normal extend, what I just named. Hit that, and then it puts it in as I like it per system. So that's one way to do it. So let's say now this works really well for specific exams. So for example, on back, I hit my default per category, and I have a normal back exam that includes strength, sensation, straight leg raise, and reflex. So you can see includes dermatomes and myotomes as well, and SI joint palpation, straight leg raising, and all in normal. So that is one option. You can build kind of a normal back exam. I have another one called normal back. Let's see what that one is. You can override your defaults. There you go. Quite similar. Normal strike sensation DTRs. Paraspinal muscles non-tender. SI joints non-tender. So everything pretty normal. I have straight leg on there twice apparently. So when you put those things in there, you can, and then go in, and if there's the one abnormal, let's say their paraspinal muscles are tender, you can go in and click that, click clear, and then you can change it. Tender, palpable, spasm, right and left. Then I can click OK. And now I've got a more detailed back exam based on the one abnormality that I found. So I find that that's pretty powerful to build kind of your own default stuff, like for example neurological. If I hit in-depth normal neuro, that's kind of you can see what I have on that, and that's one I built for my own. You can see it's called CH Chris Hire in-depth normal. So again, you have your, I check all their a pretty in-depth neuro exam. Checking motor, reflexes, pronator drift, tremor, Romberg, rapid alternating movements up here as well. Muscle atrophy. I mean, we do kind of a fairly thorough exam here. Ataxia, speech comments. So there's one way to do it, and I like to do that when you have a particularly concerning neuro complaint. It's nice to have that default there and then go in and mark in the abnormals. So that's one thing you can do by system. I highly recommend you build those. Maybe you want to build your personal in-depth neuro exam, your personal in-depth back exam, your personal in-depth. For example, if I go to musculoskeletal, I have a right knee exam and a left knee exam. You'll see my right knee exam includes, I think I just put it all in one line, but it's got everything there that I like. So on knee, I have right knee, no tenderness, swelling, redness, full range of motion, but with pain, negative Lockman's, negative McMurray. So you have a full knee exam there. And similarly, I have a left knee exam. So those are nice things to have for the types of complaints that you're seeing. Again, shoulder, I do believe I have my shoulder exam on here. Right shoulder, normal. I need to build a left shoulder. But those are basics on how to do that. So you put it in as you want, and then you click Save As. And once you do that once, you can actually click View All, and now I can click View All that I've built right there. I have an olecranon bursitis exam, but I can also change this to all people. And now I can see what everybody else has built as their personal templates for a musculoskeletal exam. So you have a JL shoulder left. I could steal that one instead of making my own left. That's a nice fast thing to do. Steal and update. So yeah, looks like somebody's made a carpal tunnel syndrome exam. So there's different things that are in there that you can do. Once you make one, then you have access to all, which is kind of cool. So that's basically how to do individualized templates per system, which I think is a powerful thing to have. The other way you can personalize, you can create templates for physical exam is just to create a template. So let me go ahead and clear this out. Now I don't have a physical exam. If I go to my, let me minimize my GoToMeeting screen. If I go to templates here and I type PE, we've created I think 1. PE adult normal CHC. I can merge that, and that's got all the systems with defaults on it. And that's one I use fairly frequently. When I do kind of a general HENT, neck, chest, lung, heart, back. That's probably the fastest way. That's faster than going system by system and merging defaults. So I'd recommend you do it that way. Build your own. So like I think I have a PEDS exam. If I click PEDS, I have a PEDS PE physical exam. So you can build a myriad of different exams and just save them as a template, and then have the template be totally blank except for physical exam. And then you can merge it onto top of whatever your node is. So you'll notice on my templates here, if I look up that physical exam, that adult one that I like to use, just called PECHC Adult Normal. If I change this to starts, I'll find it faster. Type PE. There it is, CHC, back normal. So if I click on the magnifying glass to see these, so that you'll see that there's no HPI, there's no ROS, this is just a template that has just a basic physical exam on it. And that's probably the most efficacious way to customize your physical exam, is to build individualized templates that you merge on top of your notes. If you don't, you'll notice a lot of our generalized templates have exams on them anyway, that hopefully have more specificity to what the complaint is. For example, the star CHC abdominal pain has a nice belly pain built into it that goes over peritoneal signs and the like. So, and Murphy's and McMurphy's and your different belly exam findings. So those are just different approaches to how to do your physical exam a little bit more efficiently. Now let me show you another method that I've built. I've built a category into my physical exam, which is called categories. Many of you probably don't have that on your default. I can show you how to get it if you'd like it. Now this is what I've done, is I've basically created green defaults by system. And again, this is something that won't help you on the E&M coder. So if you're pretty confident in your coding skills without having to have the E&M code count the systems for you, this is a great way to be fairly efficient with your physical exam as well, is to build something along these lines. So now I have a category I built that's just called categories, but now I've got all my systems right here. So I can just go green arrow and hit defaults that I've built this way. And this is a fairly quick way to do kind of a brief exam. And I can hit clear category. I've also created, you can have merge default here. I've created a normal general exam or a CH default, and I hit that, and it puts all those in there for me if I just do a kind of a brief physical exam. So those are, I find I'm using this one quite often. So if I see somebody for a fairly fast complaint, I'll just go to categories and I'll just do, I'll just kind of do this, and then I'm done if I don't do an HENT or something like that. So that's a kind of a nice fast way to do. It's a category called categories, which I'd be happy to add for you if you'd like. Most of you don't have it on your drop downs. So that's those are some methods for faster physical diagnosis, your physical exam findings. Now one thing I like about this, I can hit my green arrows on the normal stuff, but then let's say I do a fairly in-depth belly exam, I can click in here and then I can just go right here and I can just free text whatever finding I find. So whatever it is, and then whatever the abnormal finding is, I like to highlight and click bold, and then you can see whatever that finding is jumps out at you when you're reading through the note later. So so I like to use those bold, and you can actually make things different colors and underline them if you want, whatever the words you use. So yeah, that would be so you can see that that's been bolded, so then you can see what that looks like. If I close that out, so now I've got an exam, but you can see the abnormal finding jumps out in bold, which I really like. So there's but yeah, I made categories as kind of its own system, so again, you won't have the benefits of having the E&M coder help you out there, but that's a good way to go. Does anybody else have any? I think we just have you on there, Ben, but do you have any, have you come across any better ways to document physical exam? Or
No, I found that because I have your settings on mine, and so
okay,
I use that categories one all the time.
Which one are you using, the categories?
Yeah.
Yeah.
Because it's so much faster. I mean, especially now when I'm seeing a bunch of, like I was going over with Susie, like cold
Yeah,
symptoms.
yeah. Yeah, isn't that slick? And I like it because I kind of like to authenticate, in some ways, the abnormal findings. So if you're seeing somebody for pharyngitis or an ear infection, something quick, I like to just click an ENT and then free text my abnormal finding right here. So I'll take off the OP without erythema and exit it, and then I'll just type in whatever it is. Because it
Right.
kind of authenticates your description, I feel like, and then you can bold. Um, well, again, you can bold. So it's pretty fast.
Yeah.
So good. Glad you're liking that. At the end of the video here, I'll show people how to add that kind of stuff. Add the category section if they want it. So that's a quick way to do physical exam, and you'll notice, yeah, I do, I might advise that you start to build, so let's say you make a nice physical exam. And so I want to use this for my pharynx, for my oral pharynx exam or whatever it is. I have a nice description of an otitis or whatever it is. And I want to save this as a template to have on my right chart panel as a favorite template to merge onto a note.
Mm-hmm.
The way you do that is I'm going to go click right here on templates, the green arrow next to it, and I do save notes as template. And then you title it. So from here, you could title it test pharyngitis, and then you can make it a public because then your MAs can access it. You want to keep it on established patient. You can make it in a favorite immediately as you build it. And then in this section, all I'm going to do is I'm going to click all options and then click it again, and I'm just going to save the physical exam portion of this note as part of my template. So see how I did that? So with just saving physical exam, it's not going to keep this PKU. It's not going to keep anything down there, and I click OK. So I titled this test pharyngitis. I'm going to click OK. And now this is immediately in my favorites. Do I want to view it now? No, because I know what it looks like. So now if I refresh my right chart, I now have a new favorite template on my right chart called test pharyngitis. There it is. So if I go to physical exam, clear this one out, I can have a one-click merge of a physical exam, which I really like. So I click type test, I click arrow, and now my exam's done. See
Right.
that?
And that's huge time saver.
What's that?
So that's a huge time saver.
Oh, huge. Yeah, no, absolutely. These are very much time. They take some time to build if you want to be fairly personalized with all, which I do recommend. The way you describe things, the way you write your notes, you can really, if you spend the time to build this infrastructure, you really have the ability to be pretty efficient and have nice, authenticated, good-looking notes and the like. So, yeah, I would recommend, and build this stuff on the fly. So as you document a really nice back exam, go ahead and click Save Notes as Template or save it as a default in your back exam, whatever it may be, as I showed you all those different ways. Save it, use it, and move forward. And then you can do all this real time. It's the coolest part. So that's what I recommend doing. That whenever you see a complaint, dizziness complaint, you do a really nice neuro exam, and or hearing loss, you do your Weber, Rene, you do your full examination stuff. Save that stuff and use it for future visits. Highly recommend. And sometimes I'll even document it. I'll be like, ooh, I'm going to save this. I'm going to do a nice Weber Rene exam here. I'm going to put it as normal. Click my notes. Take 1 second, take 30 seconds, save it as a default template, save it as normal, and then if it's abnormal, then I'll change it for the abnormal exam for the patient. But now I've got it saved to normal in my defaults. So do recommend those things. Those could be huge time savers for you. Now you'll notice anything else on physical exam. I was going to move on to review systems.
No, I think that's good.
Okay, on review of systems, You do have, oops, I went too far. You do have a very similar methodology. You'll notice you have default per category, clear all, default for all. Um, I have some test sections in here that I'm working with. I think I've put those in yours, Ben, when we set you up initially. But if I click on, see, you'll notice this goes by system. So you have cardiovascular, gastrointestinal, and to click through system by system is pretty cumbersome. It's what's in there now currently, but you can click default per category. You can do, I have a cardiovascular review systems normal or a blank. So if I put in the blank, let's say I'm doing this during my huddle, which is where I think these are pretty powerful, is to do these during your huddle and ask your, send your teams know which, I like to do the blanks so your teams know which questions to ask. So I want to do cardiovascular and endocrine review systems as part of my workup for the complaint today. And now I've got those little review systems as blanks loaded. Those are powerful methods. Now I'm going to do clear all. The other way you can do that, and again, you put in what you want it to say. So my runny nose, nasal congestion, starter breath. You'll notice these fields are kind of all over the map. This is just a limited ROS. I don't like this one because it doesn't show you system by system. So the CHC limited one is kind of nice because it's pretty fast, but it doesn't really, you don't really know what's down here. You're not going to scroll through that to find chest pain, to find leg edema, you know. So you have to go system by system in order to get to, without having to click and scroll and do, you know, this kind of crap, which just drives me nuts. Having to find stuff. So within here, you have to do review systems. You cannot do one system at a time. You have to use templates and drop down. So that's what I'm showing you today. So for example, I showed you how to reload the blanks or the normals. You can click what you want in your normal cardiovascular, click notes, save as, and then you've got, name it your own. And then you've got it that way. Now I more recommend some other approaches. So let me show you those. So let's see. So I actually have these built in as just templates right here. So we've created some called star CHC. So if I type ROS, you'll see I have star CHC ROS ophthalmologic blank. Now I haven't renamed these as of yet, but I've actually put them in as defaulted as negative. And so we have a brief. These are just, 4 or 5 questions by system. So I have ophthalmologic, we have cardiovascular, constitutional, endocrine, gas, GI, GU, HENT, neck. So as I merge these, let's say whatever my chief complaint is. My chief complaint is abdominal pain, and I want to do in my huddle, and I'm thinking about what review systems I want to have on that complaint. I want to do a cardiovascular, and I want to do a GI, and I want to do a GU. So we've got those just kind of defaulted, and a constitutional. So once I've got those set that way, that's, you have to type a little bit and find them, but now I've got defaulted to negative on those 4 systems. And then you would obviously, as you ask the questions, you would update them to positive if any of them are positive, but they'll default to negative. I've been playing around with that workflow with my team, having them default to negative, and they much prefer it as they're doing some review systems. I check in and then I'll verify them, but I do like that. Now you can create, again, templates. So if I created let's go ahead and create a template right now that I like, a constitutional cardiovascular GI GU review systems. Everybody remembers, click save notes as template. In fact, let's just go ahead and create one right here. So do general, cardiovascular, GI, GU, negative. Save that as a public, make it a favorite. It's established patient. I want to click all options, unclick again. save this as just ROS, and now I've got an ROS template in my right chart panel that has those as defaulted to negative. Just gonna let clear all. So now I know the patient's coming in for abdominal pain complaint. I can do ROS. And when I search for ROS, I should be able to find that. Apparently I have a few more ROS templates. There it is right there, GIGU negative. I merged that. And now I'm off to the races. However, the abdominal pain template has essentially those review systems built into them one by one. And this is more for kind of on-the-fly stuff. As you know, the templates don't capture everything and shouldn't be. You should be also able to authentically work up different complaints as they come up in the visit. And so, yeah, let's say the chief complaint is a conjunctivitis or whatever it is, and it's a fairly simple thing to deal with, but then they also mention, or you find some belly pain on exam and you're like, we better investigate this belly pain a little further. Then you can kind of merge those different defaulted templates and different sections of the note instead of merging the whole abdominal pain template on top of what you've already done. Although that could probably work just fine as well. I frequently do that as well. But these are just different ways, different abilities to customize it within the record that I think are very beneficial. And so I kind of have a pretty diversified approach to how I go about things, as everybody else does. I'm sure mine's probably not the best way either. So there's probably a lot to be learned with how other folks are doing things. But I do kind of smorgasbord. Sometimes I use the full template. Sometimes I go in and merge just portions of a template. So if I wanted to create an abdominal pain ROS, even though maybe I just free texted it all in the HPI, but I want to steal the ROS from the abdominal pain template, I can go to abdominal pain, star CH abdominal pain template, I can click all options, click it again, go to ROS. In fact, I should probably blank out before I do this. I should probably blank out what we got, and then you can see that I have the ability, so it is blank. So if I go to ROS, if I go to templates, I can merge just portions of a template, and hopefully everybody knows that. All I have to do is type ABD, click once, click twice, ROS, and merge. And now I've got an ROS that's particular to abdominal pain. So it's got a general, a GI, and a GU. No cardiovascular, that's okay. Depends on how much you want to go into the complaint, if it's upper or lower abdominal pain, obviously. So that's where these things get, not everything fits all the time, and so the ability to customize and use things through different options is good. Or you can just, let's say you don't want to go to the templates, you can just go right to categories again, systems, and this is where I have general, skin, eyes, and the blue arrows. I didn't show you this yet, so on your settings, you can set up to have systems drop down in your ROS, and then you can have these green arrows, which I've built in, and I've made these really quite simple. Denies 3 or 4 different important pieces of the note of a review of systems in there. So you can do that this way, and this is actually probably the best place to create combo review systems that are negative. So I can create, oh, look at this, I've already done this. CH negative general HNT cardiopulmonary, CH negative general cardiopulmonary GI, CH negative GIGU, general neuromusculoskeletal, general psychendocrine, general skin heme. So if I hit that, then I've got a general, a skin, and a hematology. So if there's some sort of skin complaint or bruising complaint or bleeding complaint, I've got that handled pretty well, and I've got those built. Those will go as negatives. So systems, default per category, general psych and endocrine. If I merge that, now I've got, you'll see a negative general, a negative psych, and a negative endocrine. It puts this in this format though. It's a little less readable, but hey, all the information's there. And fairly simple to modify too by clicking on the green. Update, add, put your positives. So I think that those ROS templates are pretty powerful. I think physical exam templates are powerful, individualized ones. If your template doesn't fit the bill of the day, which is often the case. But that's basically ROS and physical exam templates in a nutshell. We should probably do HPI templates on a different day. We probably need to get folks onto clinic, but hopefully that helps.
So I could go through and I could build and then steal different pieces or build from scratch kind of ROS with physical exam and then save those all together. So I could, is that,
Totally. Yeah, you can
yeah,
build an ROS blanks or negative with a physical exam, and then again click on Save Notes as Template, and then title it, whatever you want to title it. Yeah, that could be
so like
powerful. And
today,
then if you, depending on how you like to document your HPI, but again, a lot of the templates have the full kind of ROS and physical exam and the HPI built in. But if you're not loving the templates and you want to do your own thing and kind of free text your HPI, or you like to dictate your HPI with Dragon, whatever it may be, whatever workflow you're going to find works for you, these are the ways you can customize and build and kind of find a workflow that's going to be super efficient for you. But yeah, good question.
okay,
Hopefully you remember how to do that, right? Remember templates, save notes as templates, and then save just the portions of the note that you want to keep. Name it,
right,
establish patient, make it public, add as favorite, and you're off to the races.
awesome.
All right? Well, give those things a go and let me know if you have any questions, and have a great day.
Okay, cool. You too. Thanks.
Okay, bye.